Times have been tough,
We're providing more services now than we were prior to the pandemic.
especially on our mental health.
So there's a national trend in terms of the urgency to be seen for mental health needs.
But there's hope.
Our capacity to endure and transcend is innate, and there's nothing that anyone can do to take it away.
A growing awareness around psychological well-being.
There is, in my view, parity with physical illness.
Bringing down the stigma around mental health and therapy.
My life, it's sort of a wake-up call.
We're going in depth on mental health issues here in Colorado and checking out some of the solutions that healthcare professionals, educators, and state leaders are proposing. Thanks so much for watching this 360 In-Depth report. I'm Jason Grenauer. It's Mental Health Awareness Month, and there really hasn't been a better time to examine the issue than right now. Between the health and economic struggles brought on by the pandemic and a contentious election season, it's no wonder that last year more people sought mental health services than ever before. But Colorado is having a hard time meeting that demand. Megan Lopez has more on the shortage of mental health professionals in our state that's one of the worst in the country.
Over the past year, Coloradans have had a lot to deal with. Along with the pandemic, which brought lockdowns and job loss, there were wildfires, demands for social justice, a contentious 2020 election, an insurrection, and now a Boulder mass shooting. Any one of these things is enough to cause someone to seek mental health help, and experts say that they've seen a big bump in patients.
It's not only that more people are coming in, people are not leaving as quickly either, because it's sort of the ongoing stress that's going on. And crisis calls are 30% higher now than they were a year ago.
Here's the problem, though. Colorado, like the rest of the country, is experiencing a mental health professional shortage.
My experience as a psychiatrist, we've breached capacity for behavioral health my entire career.
It's a hard line of work. It's not reimbursed as well as people who work on the physical health side in too many cases.
According to state data, in 2019, Colorado's behavioral health workforce only met 30% of the state's needs. We are currently ranked 47th in the nation when it comes to the need for care versus the access to care. That's causing long wait lists, which can be even longer in rural areas.
People can wait 60 to 90 days in some cases.
Frankly, I had a friend on the Western Slope that it was an 8-month wait. And she was like, I cannot wait for 8 months dealing with depression.
Colorado's lawmakers have introduced some bills to try to address mental health services and the shortage that Colorado is facing. But they will take time to pass and also a while to implement. In the meantime, for anyone who needs help, even with that shortage, don't wait. Call or text the Colorado Crisis Services hotline anytime. Megan Lopez, Denver 7.
Mental health and primary care services are typically separate. A bipartisan policy center says healthcare providers should integrate them. That would require primary care providers expand training for mild to moderate mental health conditions. The training would also extend to treating substance abuse conditions. The center also suggests bringing psychiatrists and mental health nurses to the same office so they can be on call. Access to mental health services is especially hard to come by for youth who might need it most. In the middle of the pandemic, the CDC reported mental health visits for children ages 5 to 11 increased 24%. The increase was 31% among 12 to 17-year-olds. Researchers say it's one of the unintended consequences of social distancing and remote learning. Suicide is the second leading cause of death among 10 to 24-year-olds. More than 1,300 people died by suicide in 2019. That was way up from the year before. While early CDC data shows death by suicides dropped last year, it was the 12th leading cause of death still. Data also shows suicidal thoughts among young people rose drastically during the pandemic. In Aurora, police have seen a startling rise in the number of suicide attempts by young people. Earlier this month, the Aurora Police Department reported 7 suicide attempts in only 6 days involving kids and teenagers. APD is encouraging parents to talk to their kids about their mental state. Some of the warning signs could include being withdrawn, losing interest in hobbies, and grades dropping. Aurora Mayor Mike Kaufman says his office is working with APD on a campaign to raise awareness. Denver7 spoke with current and former school officials about the biggest challenges for young people. The issue we heard over and over again was being cooped up at home and not being face to face with other people.
One of my previous work was as a school counselor, and I really counted on that in-person interaction to be able to assess a student and kind of see what else is going on. Sometimes that even means, their well-being for that day. Are they wearing the same clothes? Can I see any type of marks on their hands that maybe I would ask them about? And when we're in remote setting and we're trying to make those assessments without being in person, that can make it really difficult.
We can't engage the way we used to. But we're finding that kids just need that time. They need time to be with an adult or with a trusted person to talk through some of the challenges and the big emotions that they're dealing with.
Legislation introduced in the state house would improve mental health access for young people. A bill would allow anyone under the age of 18 to be offered a free mental health assessment and 3 mental health sessions with a licensed professional. The state would pay for those services. The same services would be available for people 21 and younger if they are enrolled in special education classes. Stress in kids is also making life hard for parents. With more women staying at home, moms have had to take on a lot more responsibilities. Many students require help. Some moms are actually then picking up where teachers or tutors often were. Worse yet, some women are being confined to toxic or abusive households. The director of the women's unit at Health One told Denver7 all of these stressors add up. And while it's understandably tough to reach out for help, your situation can only get better when you take care of yourself.
I think women are actually more reluctant to come into the hospital. And I think that's also where I think it's important to give women the message that the best thing you can do to take care of your family is to make sure you're healthy and take care of yourself. And that includes taking care of your emotional needs.
Dr. Westmoreland says it's very important to engage in therapy in order to heal. Health One offers group therapy, and patients learn about coping skills and how to deal with stressors in their lives. With so many people confined to their homes, many who are struggling with substance abuse found that the pandemic just made things worse. The CDC reports between September 2019 and September of last year, more than 90,000 Americans died of an overdose. That's nearly 250 Americans a day. In the last year, the number of overdoses in Colorado jumped by 30%. That's why advocates of the overdose reversal drug naloxone say carrying the drug is more important than ever. The chair of the Colorado Naloxone Project says using it won't just save someone else's life, it could give them a fresh outlook at life.
A lot of people don't recognize that besides helping reverse overdose and improve our overdose numbers, is people who get naloxone start contemplating recovery and enter into recovery much more frequently. So there's a secondary benefit. It shows people that we care about them, it shows them we want them to stay alive, and it shows them that we want their best health, and that involves the health of recovery oftentimes.
Stadler hopes the silver lining from the pandemic is that we'll all have a different perspective on treating substance abuse disorder and other mental health issues. Overdoses are still the top cause of death for Americans under the age of 50. We all can remember those horrifying images coming out of Minneapolis, Derek Chauvin's knee on George Floyd's neck last year, other incidents like it as well. They're really shaping our sense of security in many cases. Watching those sorts of graphic videos of police brutality can take a big toll on someone's mental well-being. As our Micah Smith found out, it's especially hard for people of color.
Over the past few years, Americans have watched these scenes play out in different cities across the United States.
Because to see it over and over again is going to be traumatizing.
He was a brother, a jokester. He was loved by so many.
Denver-based behavioral economist Dr. Marjorie Lewis says the shootings of unarmed Black Americans is especially traumatizing for Black communities.
We're trying to cope with a systemic approach to building this country that included the suppression and oppression of people from the very beginning.
But what can be done to deal with the trauma of seeing violent, viral videos and watching the trials of alleged perpetrators? Dr. Lewis says first, Identify and express how you're feeling.
I would say millennials probably have handled it in the healthiest of ways, because they share it, they communicate it, and they respond to it.
Another option, find a community and talk to others who may be feeling similarly. Dr. Lewis says you can also seek help from a mental health professional. During a time when the CDC has declared racism as a serious health threat, Dr. Lewis says one of the most important pieces of advice is to try to remain hopeful.
Our capacity to endure and transcend is innate, and there's nothing that anyone can do to take it away.
Experts say another tip to deal with the stress of police-involved shootings is to know when to take a break, especially from social media. That's because comments and interactions there can be triggering. Well, that does it for our 360 In-Depth report. And remember, if you or someone you know is struggling with mental health and need help, please call the Colorado Crisis Services Hotline. That number is 1-844-493-8255. You can also find mental health resources and stress management tips on our website, denverchannel.com. I'm Jason Grenauer.